everybody. Today I am talking to Dr. Imran from King's College Hospital.
My title is Chief Medical Officer, CMO they call it in short. But first and foremost, I'm an endocrinologist and diabetologist. It's a bit of a mouthful. So endocrinologist means somebody who specializes in hormones, all sorts of hormones, including thyroid, which is one of the common conditions, and then the rest of the hormones, the cortisol, the adrenaline, the rest that comes with it, and the rest of the body and the pituitary. Majority of my work is endocrine with a large proportion with diabetes, and hence the obesity along with it. It has been coined over the last few years called diabesity. So,
Diabesity. Oh my gosh, I've never heard of that before. I love that.
Diabesity is the combination of diabetes and obesity because they're so closely linked.
Right.
Because about, somewhat like 80% of diabetics are obese or carrying a higher weight than recommended.
What percent?
About 80%.
80%
Yeah.
worldwide.
Yes, in general terms, there is always a link between obesity and diabetes, though we have type 1 diabetes, which is separate from type 2, which tends to happen in the younger age group, under the age of sort of 35, and that's not got a link with obesity. That's an autoimmune condition, and that happens in even slim people.
And that's a lifelong.
Both are lifelong, more or less. But type 1 is irreversible, and you're dependent on insulin, so your life depends on insulin. If you don't have insulin, you will not be able to survive after a certain period. Whereas type 2 diabetes is not crucial to have insulin, but it is required many times. In some ways, it is reversible. There are some projects that have happened and are happening, and there are ways to reverse it. So, if you're especially a newly diagnosed diabetic, you can certainly reverse diabetes or go into a remission, as they call it. So you can do something about it.
Right.
That is type 2 diabetes.
And we're wearing blue today because
Yes.
it is.
Well, it's a special day today, and thank you very much for coming over and helping us highlight this extremely important issue, which requires a lot of attention because people ignore it. Diabetes is also known as a silent killer because we all live with it, not knowing that we actually are suffering from it. It's stealth, it sort of comes in without us realizing it. It's very common in the population. In this country, about 20% of the population has got diabetes, which is nearly coming to about 1 in 4 people. So it's a large proportion of diabetes.
And is that because of lifestyle, generally?
Yes, I think that's absolutely right. It's a high proportion is due to our lifestyles and the way we live. And obviously talk about it. But coming to your question about it being the World Diabetes Day,
Yes.
We're wearing blue because that's the color chosen for today's day. This is 14th of November, and just not an important part, but this day was specially chosen because Banting, a Canadian who first invented insulin, was born on this day. That's 14th November, so that's why they chose 14th November as the World Diabetes Day, to give respect to and to remember Banting, who has changed many lives and has made people being able to survive because he invented insulin some many years ago.
There you go. That's your fact of the day. Well,
Yes.
hopefully many more facts
Yes.
there will be today. Lifestyle.
Yes.
Is it more prevalent here because we have valet service? It's too hot to walk
Yes.
from place to place.
Well, I've moved from UK, and it's been about a year and a half now. So this part of the world is wonderful, and I'm really enjoying myself, and it's a different world. I must confess in public that when I came here, within the first 3 months or 4 months, I put on 6 kilograms of weight.
Yes,
And,
it's known as the Dubai stone. I
yes,
think.
so I certainly, and that was because Whereas I was in UK, I was washing my car and my wife's car. I was mowing the lawn.
Yes.
I was doing a lot of DIY
Normal
on the
things.
weekend, the normal things.
Yes.
And here, as I laugh when you say valet service, I don't know when I used valet service in UK. Very infrequently, or not at all.
Yeah.
And everything's done for you
Yeah,
here.
even at the hospital they have
Yes,
valet
yes,
service.
absolutely. If we could carry you at King's, we would.
You would. You'd get the
So,
Kingsman out
yeah,
there.
different culture,
Yeah.
and we have to sort of acclimatize. Coming to your point, lifestyle. Yes, it's a lot of facilities here. You know, your petrol gets delivered,
Tyler
your
pizza.
pizza, your
Yeah.
Deliveroo, your food service, your takeaways. It's incredible, and the variety
you
of.
desire.
And also the food, the restaurants, the lovely, and the place to walk is in the mall, and when you walk, you stop for a coffee, and here comes calories again. So yes, it's a difficult part, and we're all stuck to the mouse and the iPad or the computer, and you know, by shaking the mouse, which we do. I don't know how many pizzas or chapatis or we will burn by doing that. It just doesn't do the job for us. No.
So what is the number one thing that you need to get across to people?
I think the number one thing is why you're here is the awareness. I think the number one thing is awareness, and being aware that we're all vulnerable, and maybe 4 of us in the room or 5 of us, you know, one person may be suffering. It's also some statistics show that for every case that is known to have diabetes, there's a hidden case. So half the population doesn't even know they're diabetic. Typical symptoms of diabetes is the polyuria, polydipsia, which are the technical words for drinking too much. You feel thirsty, you drink more water, you pass more water, and you lose weight. But those are the extreme cases. They come on when things are really bad. But the diabetes which we are all running around at risk with and don't know is what can't be found with symptoms. So you can't rely on I'm tired today, or you know, my nails are brittle, or some other issue that people associate with diabetes. So it is about being conscious and being aware. And as we were speaking a bit earlier about you know, car maintenance, so we all know that we have to have our car serviced at 10,000 miles, or if before 3 months, whichever comes first, and there's an alarm in the car, and the garage will ring you because your car needs a service. So this is all for safety, so that you're not on the motorway and your brakes fail, or something happens. So you don't want to be caught out, and that's for your safety and for your comfort. Now similarly, I think we need to we have the facilities now. Maybe, you know, 50 years ago we didn't, but now we have our garages, if we can call our hospital a garage. I don't think it will sounds
I love
good.
that though. Let's do that. Okay.
So you have to go and take time. We never like giving a car away to the garage because it's inconvenient. It takes time. It costs us time and money, and it's inconvenient. So going to a hospital and feeling as if you know, there's something wrong with you. That's we only go to the hospital when the car breaks down. The idea is that no, you don't wait for it to break down. You go for your maintenance check, they tick boxes, and they say you're good to go for, let's say, another 6 months or a year, as the case may be, depending on your risk factors. So I think the message is, do get yourself checked. Do look after your health. Don't ignore it. And as the famous saying, health is wealth. You know, all our jobs, our lives, our families are all dependent on our health. So it has to be given priority. These are silent killers. They will not tell us, and we need to check. And it's simple, maybe a finger blood test or a routine blood test. Along with it, when you're having a health check, you know what your blood pressure is, what your cholesterol is. Again, I deal with one of my special interests is cholesterol and hypertension, which go hand in hand with diabetes. So diabetes tends to come as a package. It was known, or some people will call it the metabolic syndrome, and that comes with insulin resistance. So that takes us into this sort of group of people who are the common people who then land up with the complications, which includes high blood pressure, which they don't know. People say, I get a headache, my blood pressure is okay, No, you need to have to know your numbers, you need to know your blood pressure, you need to know your cholesterol, you need to know your numbers, you need to know your diabetes, you need to know your numbers. Similarly, when you take your car for your MOT, your service, they check your wiper fluid, the brake fluid, you know, the brakes, they do the whole check. And I think that's what people do ignore because of their inconvenience, or sometimes they don't want to know about it.
But also, a health check isn't always covered by insurance, and so it can be a, oh, I don't know if I want to spend that much
Yes,
money.
and true. But then when I go to Ritz or wherever I go for a meal, it's
Yeah,
not
because
covered
they're
by.
not prioritising them,
Yes.
their
So
health.
it's your priority.
Yes.
It's you know, do I want to go on a cruise, or do I want to have spend that money on my health? So
Yes.
people are used to either the NHS or the health insurance, and they feel entitled, and they don't want to spend their money. They'll spend their money on clothes and their car, but not on their health. Whereas actually we have to invest in our health. It's more expensive to look after the complications and deal with the complications. It becomes terribly expensive, both in time and fixing things for yourself.
We choose to spend money on a new pair of shoes rather than getting a health check. It is something that we don't think about, and that is the future is an old people's home, or death, or long-term illness
Yes.
if you don't nip it in the bud.
True. Interestingly, you mentioned old people's home. My experience in UK, having lived there for 25 years or longer, 28 years in UK, this is a personal observation. I've never seen a obese, overweight person in a nursing home. They're always the very slim, thin people in nursing home, and you think why? Because the overweight doesn't make it to the nursing home. They die before the nursing home are full of people who are 80, 90 or 100 years old. In UK,
Yes.
they're about, all of them are above 80, 85.
Yes.
The obese, overweight with the tummy sticking out doesn't make it more than 60, 65. So they never
Now
make
that
it to
is
the nursing home.
a scary
That's just an
thought.
observation.
Yes.
They just don't make it. Yes, when you become frail and you've had a good life and you've been exercising and yes, your car does become old and it does require help and support.
Rusty.
But that's when you're 90, when you're 80. You don't. The hospitals are full of the 60 years old and the 55 years old. You know, the files are this big nowadays. Obviously, on the computers we don't have files, but the proper NHS files are huge, thick for the 50-year-old. And if you look at the obesity, which is the curse of all our or many of our medical conditions, is due to obesity. We cause cancers due to obesity, high blood pressure due to obesity, diabetes, heart disease, stroke, everything.
Yeah.
It's something we can't ignore. It's something we have to tackle. As we age, and as I've learned, I can't skip over my garden wall or do things which I was able to when I was 20. The body itself changes with time. Including your hormones, including your metabolism, including your muscle mass, and including your cardiac output. And that's a natural phenomenon. So we lose a little bit of muscle every year, a little bit of cardiac output every year. And our metabolism slows. So the amount of calories in food we require when we're 25 or 35 is not the same what we require at 55.
No.
And if you take your car out every day, and you do your school run, you need more fuel. But if you're going to go shopping only once a week, you need less fuel. So as we age, we need less fuel, and we have to accept it that we require less fuel, or we have to take our car out more. So if you want to refuel, because you have pleasures in your life, then you've got to take your car out for a drive, and that's where exercise and comes in relation to your weight.
I am really enjoying this car analogy.
Yes, a lot of things I talk about is associated
so
with the car.
check your washer fluid.
Yes.
Reversibility.
Yes.
Is there such a thing?
Yes, there is, and we always knew it, but recently, I'm not talking long, but a few years back, there was some good data from Newcastle and Professor Taylor, and they did some research on it, and they've shown that if we reduce our calories significantly to about 800 calories, which is nearly half of what we normally would have. So normally we'd expect somebody who's got a sedentary job or working needs about 1600 or 1800 calories. And they reduced it to nearly half. And they did it in a very experimental mode in which there were meal replacements given rather than ordinary food, and they showed that diabetes was completely reversed. Now, it's
Wow.
yes, and this is, as we know, lifelong condition. On the other hand, I feel, and there is again data available, that we can do it without maybe even going into the extreme meal replacements. We have facilities at King's to provide that also.
With a nutritionist.
With the nutritionist and giving meal replacements, but some people find it difficult to move from their normal eating habits, and I do understand that, and hence again it comes to reducing the calories. And yes, diabetes can be reversed because we are again overburdened the, let's use the word, the car again with too much luggage in it, and the engine's not strong enough. So you've got to remove what's in your boot and take the excess weight off, and hence the car will move forward without any problem, more freely.
Yeah.
So yes, we accumulate baggage, and we need to get rid of it.
My nickname's baggage. In our family, we are very strict about exercise and what we eat. And so if we don't exercise on that particular day, then we are more strict about what we're eating on that day. If you run a marathon, then you're allowed to treat yourself a little bit more. And so as a whole, as a family, that is the way that we run our lives. What are your thoughts on that?
I think there's a bit of a myth again about as if exercise is a replacement for overeating. There's some misconceptions on how much it takes. About 20 minutes to burn off one digestive biscuit.
Without the chocolate.
Without the chocolate.
Yeah.
And to burn about half a pound of weight, 500, half a kilo of weight, you have to walk 35 miles. So you can't eat and then think, oh, I'll go for a 2-hour walk or a half an hour walk and it'll go. It doesn't go. You'll have to run a marathon to get rid of an overeating episode you've had in the shopping mall. I had a research project again in UK which I thought, and it didn't ever come to fruition, was about changing the packaging labeling, and instead of putting how many carbohydrates and proteins and was in the food in this bowl, which you can't stop. So I suggested, and it was discussed, but it never came, was that you put, instead of putting the calories or the small print, you just put a label of 20 minutes. So if a bag of crisps, it writes on it 20 minutes, means you have to walk 20 minutes to burn this bag of crisps. And if you buy a pack of biscuits, it says the whole pack is 2 hours of walking. So if you could associate your food with the calories, I called it walk to burn calories. So you pick up a can of Coke and it says 40 minutes. So you look at that and saying, okay, this is a soft drink, this is 40 minutes, and this is some sparkling water, that's no minutes. So you will be choices. So I think people look at certain nutritional factors, but they don't look at the calorie intake and how long will it take for them to burn that. So I think there's a slight misconception that you can, to burn a cappuccino, you'll have to walk about half an hour or 45 minutes to burn one cappuccino. And you might say, oh, I only had a mocha and I didn't have a biscuit with it. But yes, you've got to walk half an hour.
During a whole day, when people approach me and say, oh, what do you eat? I'm not
very
losing
little,
weight.
I would imagine, looking at you.
I don't eat a great deal during the week. At the weekend, I do special. I ate your wife's scones, which were amazing. Is that it's difficult to add your calories up during the day because you choose to, I don't know if you choose to ignore things, but unless you write down absolutely everything you eat in a day, you have no idea.
Absolutely. This is music to my ears. I say to patients, I've got a lot of these lot of apps are available now on your phones, and you could use anything, from My Fitness Pal or whatever you want to use, and you just count your calories, and it tells you that okay, I require 18 or 1600 calories, and whether I've reached my calories now, how you do it, whether you do intermittent fasting, whether you want to do it in whatever way. There are different ways to deal with it. But one thing to watch out, which some of my patients go wrong, is that they're very good through the week, and they say, I've been a good girl or a good boy, I've been very careful, but on the weekend they would take 6,000 calories. Now you've averaged that over 6 days, they're taking 2,500 calories a day. So it's just like being paid less, but then suddenly getting a big bonus end of the year or end of the month. So that doesn't work also. So you can't have these cheat days or sin days of being careful through the weekend. The weekend is horrendous. It's you have to watch it throughout.
Yeah, my weekend is not horrendous, but it is a little bit naughty, and I do allow myself to.
And you can do that, but then you have to be more careful during the week, and you exercise.
Yes. Yeah.
Well, whatever you're doing a great job.
Thank you very much. Dr. Emran, at King's, you don't have to go for the full health check if you are worried about diabetes after this discussion, which we all should be a little bit concerned generally.
That's health in general, diabetes
in
in particular, because it's, like I mentioned, a silent killer.
So you can go and see a doctor?
Yes. You don't need to see a specialist like myself unless you have a problem, because as a diabetologist I deal with patients who have diabetes.
Right.
But for screening, you best go to King's College London. We've got a lovely institution. In Dubai, yeah. And we have very high standards, which we keep as being part of King's College London. And you can go to family clinics. You could have your health check there. Again, I think it's an investment in your life, and I would encourage you to have your tests done at least once a year, if not more often. And the risk factors are high, especially in a lot of people from different ethnic areas, and we're all in that sort of sedentary lifestyles, and 1 in 4 people, as I mentioned, so it could be me or you, 4 people sitting in the room, something not to be ignored.
Do ethnicities count for diabetes?
Yes, it's higher. The obesity, when we call it, is a very, very general term as the body mass index. It gives us an idea, but we have to focus on central obesity. So people who put a lot of weight around their waist, and that is particular about people from the Indian subcontinent. They're very vulnerable to putting on weight around their waist, so they would appear slim, but would have a bigger waist, even if they keep their belt lower down, the belly is hanging on top of it. That's the people who are at higher risk. And to accept that, oh yes, after 2 or 3 pregnancies I put on weight is not acceptable. It is what happens, but that's where then leads to diabetes. And one thing we didn't mention, which I've seen exceptionally high in this part of the world, is gestational diabetes, which is women getting diabetes during pregnancy.
Yes.
Now, having practiced in UK for 28 years, I had a clinic in which we looked after pregnant diabetic women, but there were limited numbers. Here, it's exceptionally high. One is obviously there's a bigger age group of women in the pregnancy age group, but also because of the ethnicity and the lifestyles, and it has significant consequences to the baby and the birth, and a lot of hard work goes in during pregnancy if you have gestational diabetes to keep the baby protected.
Right.
So again, very important if you're starting a family, make sure your weight and diet and exercise is good, so that when you get pregnant,
you can have a healthy
baby.
Yeah. Male, female, does that make an issue to diabetes?
Not really. It's more or less across the board.
Really?
Yeah. The local Emirati population is slightly at a higher risk also. Again, depending on the lifestyles, and also I think a little bit sad bit about which I've noticed here is that people have sort of accepted diabetes as just one of those things.
Mm.
And when something becomes common, then you start accepting it. Like obesity, particularly in children, is becoming acceptable. So when I ask a patient to get to know their family history, I ask them, is your husband or your wife obese or overweight? I'll never get the right answer because they'll call them pudgy or chubby or something else. But actually, I have to use the word skinny. So the only way I can find out if somebody's overweight is saying, are they skinny? Because skinny means normal. Whereas I think that's changed with time. People have accepted being overweight. And similarly, I think in Dubai, I have this feeling that people have accepted diabetes in like one of those things. And that's not correct, because that has significant consequences later on in your life, how diabetes affects your eyesight, your neuropathy, as you call it, nerve situations, heart attacks, kidney failure, the associated high blood pressure and things that go along with it. So it's a dangerous condition.
What about losing toes? What is
Not a
that?
topic that you want to have too much discussion on, but diabetes has a significant effect on the circulation, whether it's to the heart or the brain, but also particularly the part which is furthest away from you is your feet or toes.
So it's not getting blood?
Not getting enough blood, oxygen,
flow,
and on
right.
top of it, you don't have a good feel, you can't feel things very well. So you develop an ulcer or an infection, and that gets bad, and that leads to
Because
gangrene.
you didn't know it was there?
Yes, you didn't know it was there, you neglect it, and it turns into gangrene, and then that part has to be removed. So one of the world's biggest, unfortunately, cause of amputation is due to diabetes.
Gangrene I thought was a really old-fashioned thing. I didn't know it was still a thing.
It is, unfortunately, in diabetics, and I think that remains to them. You would have seen it in context with the First World War in the trenches, but now diabetes is the cause of gangrene. Again, if you attend to it earlier, then nobody should ever even, this word gangrene should disappear from our dictionary. But it's all about looking after and maintaining your body.
Your car.
Absolutely.
Dr. Emran, as Chief Medical Officer of King's College Hospital, if you had a billboard, and Dubai has the biggest billboards, what would you write on it?
Wonderful question. I'd probably put something striking saying, do you have diabetes? Have you checked it? Please come to King's College Hospital, find out if you have or not, something of that order.
I think that is a really, really good question. Do you have diabetes? Thank you.
Thank you. Thanks very much for your time.